What's going on, guys? Dr. Andrew Fix back here for another episode on the code. Thank you so much for tuning in, joining us, and I hope you get something of value out of this episode. To kick it off, I just want to let you guys know this episode has actually come by request of one of our listeners, one of our clients at Physio Room. We were having this conversation in the office, and she said, this is something you should record a podcast on because I didn't know what to do in this scenario until I wound up here and you gave me some information and someone told me to come see you guys. I didn't know what to do in this situation, and I bet you there are a lot of other people going through the same thing. And what we're going to talk about is what to do when you get hurt, right? You're hurt, and now what do you do? And before we dive into like what you should do, I think what's important to note is like assess what we're talking about. Like what type of I'm hurt, injured scenario are we actually talking about? So let's lay out a couple different scenarios. Say, for example, you are going to the gym regularly and you're lifting weights and your shoulder starts to hurt. We were working a CrossFit competition yesterday, and there were a lot of people with shoulder pain, back pain, etc., pushing through their lifts and through their workouts. That's a very different scenario than you fell while you were skiing and you really took a hard fall and you took a tumble, right? Is it an insidious, meaning it's just kind of like something that came on, there wasn't an acute traumatic incident, and is it just kind of there nagging you? Or is it an acute traumatic scenario? And how you're going to handle or manage these two scenarios from a triaging standpoint could be very different. So let's talk about what's the most common, right? What's most common in our office, and I think with people in general, are these more non-acute, recurrent little flare-up things that just are nagging you. The shoulder pain while you're in the gym, the back pain when you spend too long in one position, the morning stiffness you wake up with, that frustrating ankle because you injured it years ago when you were in high school basketball, and it just still continues to give you trouble. So if you're going about your daily activities, you're going about your workouts, you're doing your thing, or maybe you're with the family, you have a long trip at Disney World or something, and now your ankle is really starting to bother you. What I would recommend doing in one of those types of situations is, first off, if you have a person, if you've got a guy or a woman who you really trust and believe in and value, like a great physical therapist, like an awesome chiropractor, a physician that like and trust, I would reach out to that person, right? Because they might be able to help point you in the right direction. And of course, we're all going to come to that scenario with a little bit of our own bias, right? Like, I'm a physical therapist. I want to assess things. I want to check that person's ankle out. I want to look at their shoulder, and I want to see what I think is going on to see if I think I can be of value or of benefit to that person to help them get that feeling better. But what I also want to do is be able to make sure I can point that person in the right direction if our office is not the place. So first off, reach out to that person. If it's one of those atraumatic, not traumatic, just frustratingly there all the time kind of things, that's not usually the scenario where you need to go get imaging, right? Because typically that image is not going to dictate one way or the other what your care is. It would have to show something pretty dramatic, right? Like, we use the example of back pain. And if someone's going to go get an MRI, that MRI of their back would have to show something pretty dramatic for it to actually change the course of treatment that we're doing in our office, or that a chiropractor is doing in theirs, or that a massage therapist or an acupuncturist or whomever is doing in their office. That would have to show something very significant, way more than a bulged disc or arthritis or something like that in the spine. And those are the more common things that are going to show up anyways. Those aren't going to change how we treat you, because we're going to treat you based off of your clinical presentation, not based off of what that image shows. But those atraumatic scenarios aren't usually the ones where you're going to need imaging or something for. It's something where I would recommend, especially if you're in a state like Colorado or Wisconsin, where I'm from, that has really good healthcare laws. And what I mean is very open access, direct access, meaning you don't need a referral to go to certain places. In those scenarios, I would skip the line. I would skip the line at the medical system, and I would not worry about going to your primary care provider, going to urgent care, going to the emergency department, and doing all of these things for something that you probably are going to get a more thorough assessment by going to see a really good physical therapist, a really good chiropractor. If you have the ability, go straight to the specialist, right? And that specialist could be the PT, the chiro, the orthopedic, the neurologist. Because if you go down the route of going to urgent care, more than likely, they're not going to be well equipped to handle what it is you're dealing with, a musculoskeletal ache and pain. That's not their specialty typically. They just want to triage things and get you out of their office as quickly as they can because they're there for urgent matters that are just a step below the emergency department, right? They're not there for back pain. That's not what urgent care was designed to be, nor what they're the specialists in. Neither is the primary care office. They're there for general health things, right? Illnesses, the cold, the flu, the whatever, ruling out other diseases or things that might be going on. The primary care provider in most situations is not going to be the ideal person, and they would agree with this, for shoulder pain, for knee pain, for back pain, for nutrition related questions. That's not their specialty. They get a very small amount of material on these topics when they're in school, in the medical school. So if you're dealing with one of those musculoskeletal type of things that's just kind of nagging you, you want to go straight to the musculoskeletal, movement-based, functional type of providers. The PT, the chiropractor, the orthopedic that has a good reputation for referring to PT, because in many of these situations, you don't need things like x-rays, MRIs, imaging. And when you see a really good one of these providers, they should be able to point you to getting that thing and giving you a referral if you need it, right? And let me tell you a story. So we had a couple of these incidents happen in our office over the past year. Someone came in with pain in their leg, right? Upper leg, kind of in the hip area. And, we're treating it as if it's a high hamstring related problem. And this is a runner. And it's kind of improving, but it's not quite improving to the extent that we would want. And their story did match, right? As if it was a high hamstring tendinopathy problem where it attaches on the pelvis. But then their symptoms changed and they came in the office on a different appointment. Their symptoms changed and now they're having front of the hip pain. And the story is a little bit different. And in the office, things are just starting to not make sense, right? It's like, okay, well, your symptoms were here. These were the things we were doing about it. Now your symptoms are here. Your activity has changed. Okay, things aren't making sense anymore. This is starting to not seem like your cut and dry, like tendinitis type of problem, tendinopathy type of problem. So this was a scenario because of this person's activity, going from the swimming season to the track season in high school, going from not running, non-impact activity to impact-based activity, and ramping up their volume relatively quickly here in the spring. We decided we need to refer this young lady for an MRI just to rule out on the off chance there might be a stress fracture or a stress reaction related problem to the bone stress injury, as we call it. And sure enough, that's exactly what it was. And we were so glad, her and her parents were so glad that we referred her for that image, right? Because we want to make sure we address those things. Now, what we could do is we could have continued to just go down the rabbit hole and assume that this was a tendon related problem. But when the story starts not making sense, we're going to refer that person out and make sure we're checking all the boxes that we need to catch the things that we need to catch. And that's why you need to get things like this checked out, right? If you just have that nagging pain that's not going away, continuing to do things like take ibuprofen, rest it, ice it, go on and off with your activity just to modify and manage the symptoms, that's not fixing the problem. And we all know that. You need to go get these things looked at. You need to get it checked out by a provider that you trust and let them point you in the direction to get this thing addressed once and for all, right? Or get you into a different provider's office if they're not the one. Now, let's talk about a very different scenario. If you're skiing and you fall and you really take a tumble, you hit your head, you feel or hear a crack or a pop. These are different scenarios where it's an acute, meaning it happened like immediately, It is traumatic, meaning there was an injury involved. Think of like someone tears their ACL in a football or a soccer game. These are scenarios where you do probably want to go get the imaging, right? You want to go to urgent care or to the ER to make sure that something very serious didn't happen if you hit your head skiing, to make especially if you're like having neck pain or you're having concussion-like symptoms. You want to rule out really significant problems like a brain bleed or like a fracture in the neck or something like that, because you just don't want to take a chance with your health. Right? I understand that stuff costs money, and I'm not telling you to be frivolous with just go get all the tests, but that's why we have things like health insurance, or hopefully you do, for when an actual situation happens that is emergent or that is traumatic, so that you're not stuck with the bill for like tens of thousands of dollars, and you have the coverage that you need for when a real problem happens. You want to have that there to ensure your life. So if you have that traumatic situation, you feel something pop, maybe you're trail running and you really just take a bad step and you just feel like you trash your ankle, right? And you think there's a chance you could have broken your ankle. Those are good scenarios to go get that checked out, get the imaging. Again, you're probably going to have to call a provider that you know, like, and trust. They're probably going to have to see you so that they can submit a referral for you to go get the imaging. It might be possible to like quickly get to urgent care, go get that x-ray or something. But you're gonna have to go somewhere. You're probably not just going to walk into the imaging facility and be able to get an image by yourself without a referral. However, get the image. And then what, right? And then what do you do? So if you've ruled out the very significant problems, you don't have a fracture in your neck, you might have a concussion, but you don't have anything more significant like a bleed or something going on, or swelling in the brain. If you hit your head, you don't have a fracture of your ankle if you go get that imaged, and you took a digger trail running, or you crash your mountain bike and you decide to go get the x-ray, but you don't have a broken wrist. That's great. So now what do you do? Well, now we're back to the same scenario we were talking about before. Now we need to go get into a provider's office that we know, like, and trust. And when it's a musculoskeletal related problem, again, that's probably not going to be your primary care provider. That's probably not going to be urgent care or the emergency department that's going to direct you to the right person to see in these scenarios. You probably need to go to the very skilled PT, the very skilled chiropractor. Probably not the office where the patients or the clients are in and out in a matter of minutes because they're just getting a quick hands-on tune-up, or there's something like they're actually spending time being able to talk to the provider about what happened. They're not just in and out in 5 to 10 minutes. Maybe you're going straight to the specialist. Maybe you're going to a great sports medicine physician that you know, so that you can get these things assessed and you can go down the right track of treatment. Because for most things, the right track of treatment is not to rest it for a week and then see if it gets better. ICE is almost never going to be the right course of treatment. That acronym, RICE, RICE, rest, ice, compress, and elevate, man, those things are outdated. If we're even going to ice something, one, you should do it with the mindset of, I'm changing the pain as opposed to improving the swelling, because ice causes vasoconstriction. The cold causes vasoconstriction. We need the blood supply. We need vasodilation. We need to get mediators, macrophages, other things through the bloodstream to the area that's injured to help it heal, to clean up debris and get things out through our bloodstream and lymphatic system. If you're going to ice something, man, it better be within the first like 12 hours of an incident happening. Not like, oh, I iced my shins after every track practice because my shins hurt. That's the wrong mentality to try and fix something, because it's just a pain manager at that point. It's changing symptoms. It's not helping from an inflammatory standpoint, because we need that blood flow. Our tissues need the blood flow in order for them to heal and improve. So just think about that. Rice is outdated. In other words, we want to do things like move the area as comfortably as we can, continue doing the activities that we can do without increasing our pain or symptoms, and continue to work around it. So again, let's jump back to that previous scenario. Hopefully you don't feel like we're going all over the place, but but this is like a confusing thing in people's minds. When you have something that is bothering you, a back pain that you just kind of tweak shoveling, when you talk to a really good provider, what they're going to tell you is, I want you to continue being as active as you as active as you can without making the problem worse. We're not going to tell you to lay on the couch and watch movies all day or watch Netflix all day. If you have arthritis in your knee or in your hip, we're not going to tell you to stop squatting and to stop doing things. We are going to tell you to keep being as active as you can, to continue to strengthen, continue to work on mobility, continue to do the functional activities you have to do, and try not to make it worse. So I had this conversation with a client in the office last week. We were talking about arthritis in the knee. She was told by an orthopedic not to do squats. So then we just started going through her day and started talking about all the squats that she has to do on and off the toilet, on and off the couch or the chair, in and out of the car, picking things up off the floor. It's a hinge, right? It's a deadlift, but depending how you do it, it could be a squat. So how do we avoid doing squats? We don't avoid doing squats. We just try to get as strong and as mobile as we can in the ranges that we need to be able to function. You know, he had suggested to her to take the elevator, not the stairs. Well, if we never take stairs, you guys, what's going to happen is we're just going to get weaker. Our ankle's going to lose range of motion, and we're going to become really limited in our ability to even take the stairs if we wanted to, or go up and down curbs, which is with as much ease as we have now. So what I had suggested to her instead was, okay, I totally understand where your physician is coming from. He wants to not make this arthritic knee worse, but you're not really going to make it worse by continuing to do these things, because arthritis is more than just a wear and tear type of problem. It's a whole lifestyle and a movement problem. And we want to continue to get you stronger. So we need to do things, and wouldn't you rather have more strength and more mobility despite the fact that you have pain, instead of have pain and be weaker and less mobile, therefore less functional? So we want to maintain our function as long as we can. Now, I told her, I don't want you to go do squats and just continue pushing deeper and deeper and deeper. If that's really killing your knee, don't do that. But work in a range that's tolerable to you, where it doesn't feel like you're getting it worse. And let's get you as strong and as mobile as we can in that range. And then we'll go from there, because you're not making it worse. But back to sort of sum this up. I mean, again, this topic came out of a conversation with a client, and she said, I didn't know like what I should do. My shoulder's been hurting me. I didn't know who I should go see. I didn't know if it should be my primary care. I didn't know if it should be my ortho. I didn't know what to do. So we've got a lot of options, right? We could go to the emergency room. We could go to urgent care. We could get imaging. We could see our primary care or a physician specialist, an ortho, a neuro, a whatever that might be, an endocrinologist or some sort. We could see a chiropractor, a physical therapist, a massage therapist, acupuncturist, you name it. There's a lot of different ists, providers that you can see, right? But it depends on what you're going through. If you're dealing with a musculoskeletal related problem, you should seek out a musculoskeletal style provider, right? A PT, a chiropractor, an orthopedic, something like that. And if it's a traumatic incident, that's where we want to consider the imaging. Or if it's a very chronic, insidious thing where one of those providers that you see just doesn't think that things are making sense, right? Your symptoms don't follow the classical story. That's when we're going to refer for imaging. We're going to refer you out for an MRI or for an X-ray or something like that. When you have the traumatic incident, go to the providers or go to the offices that are meant for those scenarios. If you take a really bad crash and you think there's a real chance you might have broken something, go get it imaged. Like, don't wait around to, wait 3 days to find your wrist super swollen, to then find out you broke your wrist and you should have had it immobilized 3 days ago. Just go get it done so that you can get on the path to recovery and to healing, so that you don't set yourself back farther. And when you are dealing with one of those less non-traumatic, more just kind of there all the time scenarios, continue to be as active as you can. Seek out a provider that's not going to tell you, oh, your shoulder hurts when you do this, when you reach up overhead, just stop reaching up overhead. It hurts when you squat. Oh, just stop squatting. Those are not answers, right? Those are just avoiding the problem, avoiding the situation, and not working to fix it. So make sure you find a person that you know, like, and trust that'll point you in the right direction, whether or not that fills their bank account or their pocket. Because at the end of the day, we just want to help you get the outcomes and the results and the help that you need, whether that's in our office or not, or whether any other good provider that we know, that's what they're going to do too. So make sure you find yourself one of those. If you have questions about a situation that you are dealing with, man, reach out to me. All of our information's in the show notes. My email is andrew@physioroomco.com. I'd be happy to point you in the right direction or give you an extra set of eyes or ears on a situation that you're going through. And again, I just really appreciate you tuning in, listening to this episode of the Code Podcast. If you've not done so already, man, a review would go really, really far. We're trying to get up to 200 5-star reviews on this show. So if you've not already left us one, that would be awesome if you could leave us a review. Send us your questions, and we'll do our best to get you answers to what you're going through. Thank you again for joining me, and we hope to catch you on another episode of The Code. Later, guys.